Hey guys, this is David Cruz with the Optimum Advantage Podcast. Today I have Dr. Alaina Rajagopal, and she actually has a PhD and a background in NASA. I'm super excited to talk to her. How you doing?
Good. Thank you so much for having me.
Oh, no problem. I'm actually really excited to get to know you. Do you have a company, right? You're the CEO.
I'm the chief medical officer and co-founder. My husband and co-founder is actually the CEO.
Oh, okay. So you guys run it together, kind of.
Mhm. Yeah,
Cool. Can you tell us a little bit about like what it is that you do?
sure. So I am an emergency medicine physician by training, but I got involved in medical devices because of some of my work in austere environments. So anywhere where it's really difficult to practice medicine. And part of the problem in those environments is, you don't have a CT scanner, you can't do blood draws. The quality of care that you can provide for your patients in those environments is a lot different than what I can provide for my patients in Los Angeles. So I started talking to my husband, who's also a physicist and an engineer, about ways that we can improve medical technologies for use in some of these remote locations. And so that kind of led us down the pathway to ultrasound. And then as an easy first project, we thought we'd tackle blood pressure. Turns out it's not that easy. And so we've been working for a while to try to figure out a way that we can measure blood pressure better, non-invasively, continuously, without a squeezing cuff, without an invasive arterial catheter. And we eventually developed a method called resonance sonomanometry. And so that's what the company is based on, is developing this method and a device that uses this method to make blood pressure measurement as well as monitoring of other cardiovascular parameters much easier, less expensive, and more comprehensive than is currently available.
That's incredible. So you guys actually created your own proprietary technology and
Mhm.
like it's all patented and everything?
Yep. Yeah.
That's impressive.
Thank
And
you.
I'm
It's
sure
been a long
it's
road.
I can't imagine. I mean, even just the technology itself, it sounds like, you guys put a lot of work into it.
Yeah.
So when did you guys start the company?
Um, I think the company started in 2018. We really started working with more focus on the method and developing the company around like the 2020 timeframe. So, why not start something in the middle of the pandemic?
Perfect timing.
Yeah.
No, and that's great. So you went through the FDA process and everything like that? You guys in the US?
No, we are not a cleared device. So we're still in a research and development stage. So we have developed the method, and right now we're working to create a device that can be used in hospital environments and also potentially for remote patient monitoring or out of hospital environments. So kind of in that technology development process, and then also making the technology as easy to use as humanly possible.
Oh, wow, that's so cool. So are you, in sales yet? Like, have you guys, started selling yet or not yet?
No, we can't sell until we have a regulatory clearance. So we'll have to go
Gotcha,
through that whole
gotcha. When do
process.
you guys think you're gonna be able to do that?
We're looking at probably the next like year to 2 years.
Got you. Yeah, I know that process is probably so stringent, and, yeah, I actually have a buddy that's going through that, but and with good reason, right? But I mean,
Yeah.
it's just, so this is an entire lengthy process you guys actually started, I'm sure even way before the company started, right? Like
Yeah. A few years before that, we'd started looking at blood pressure again, thinking, oh, this can't be that hard. And so we developed a couple of other methods that were using machine learning and blood flow and ultrasound. And ultimately, what we found was that it gets you close, but it still requires a calibration step. And so I'm an ER doctor. I just don't have time for calibration. And, if I have to put on another device and then calibrate it, I'm just going to use the blood pressure cuff or the arterial catheter or whatever I placed in the first place. So we threw those methods away. And then with machine learning, you're only as good as your underlying data set. And so unless we could comprehensively include, 7 billion people on the planet and every physiologic variation of those people, there were always going to be situations in which the technology failed. And again,
Uh,
that's not really the goal. That's not what we were trying to do. We wanted something that worked whether you were using it in a hospital or on a mountaintop or in space. And so we really needed to look at the fundamental physics and understand how we could actually measure blood pressure rather than estimating it. And so uh it was a long process to your point.
I can absolutely imagine. Now, is this something that like it would help like significantly statistically with like people that are in like high like stress situations? Like for instance, you're an ER doctor. Like to be able to get somebody's blood pressure, does that save you time to be able to save them? Is that the whole concept behind it?
Yeah, I think there's a lot of inefficiency right now in vital sign monitoring and blood pressure measurement. So, in the ER and the ICU and a lot of other places in the hospital, we have these electronic medical records and there are computers everywhere and everybody is hooked up to technology. But a lot of times those technologies don't talk to one another. And so, a lot of times when I want to know what a patient's blood pressure is right now, I still have to walk to the room and look at the monitor and press a button and take a blood pressure. And so that, while it doesn't sound like it takes that long, if somebody's in a different unit or on a different floor, the walking there takes time. And the going in the room, taking the measurement, waiting for things to run takes a lot of time. And that's time that, I could be spending talking to patients or writing up charts or doing procedures or any number of other things. So I think one thing this does is it sort of automates the measurement of vital signs, including blood pressure, but it also allows us to look continuously at blood pressure, where right now we can only continuously see blood pressure if we place an arterial catheter. So that's invasive. It's a needle, it goes right into your artery. And then the catheter stays in place. And that can lead to a lot of complications, a lot of side effects. So we don't put them in healthy people. We only put them in the sickest patients in the hospital, people in the ICU or the operating room. And so that means there's this wealth of data that we could get from continuous monitoring that we just don't have on healthy people. And so it could really help us better understand how people's physiology changes throughout the day, how their blood pressure increases or decreases with various stressors or with eating. And with our method, we also measure arterial stiffness, arterial radius, arterial wall thickness, pulse, respiration, skin temperature. So, with all of these metrics put together, we can really start to comprehensively understand how someone's cardiovascular system is acting and responding to things throughout their day. And that might help us predict things like heart attack or strokes or any number of other problems. And if we can predict them, then maybe we can treat them before they happen. So there's a lot of really exciting things that could come from a technology like this.
That's so incredible. I mean, as somebody that's not really versed in medical devices and science, like I think we're just so far advanced. I would have thought that we had something like this already. I mean, like the method that we have now. Do you know when the last time that was updated at all?
Yeah, to your point, we can go to the moon, but we've still been measuring blood pressure essentially the same way since like early 1900s, over 100 years. So the blood pressure cuff is kind of the standard method that we all use. It squeezes the arm. It takes one measurement every time it squeezes the arm, which is also uncomfortable. And then the other so that's sort of the standard of care. And then the gold standard is the arterial catheter that I talked about. And so that's like actually sticking a catheter attached to a pressure transducer into the artery. And there's a lot of reasons you don't want to do that on healthy people. And so there's a lot of other methods that have been developed over time to try to develop a continuous non-invasive technology, but most of them are just or all of them are just estimating various parameters or using machine learning or um, getting close to a measurement, but not actually taking a measurement. And so I think that's why a lot of the technology in the field hasn't been widely adopted or used as much as the blood pressure cuff or the arterial catheter.
Wow. So this is something that's long overdue, and I think it's kind of revolutionary because I mean, if you really think about it, with all the advancements that we have in AI, and we've seen AI kind of like be able to read different scans and things like that. Like even just being able to put all that data, like you said, what kind of things would that be able to? Because it seems like this device even takes in more data than even the catheter, if I'm not mistaken.
Mhm.
So
Yeah.
having something with that much data that you could just transfer over to something that automates it, maybe like AI, like what kind of things would you be able to like see?
Yeah. So to your point, there's a massive amount of data. I think if we sort of collect everything, we can collect terabytes of data very, very quickly in an hour or a couple of hours. So, yeah, I think there's a lot of use for being able to use AI in order to um, help mine the data and recognize patterns that might be more challenging for people to recognize individually without using that help. And so when you start looking at patterns, for example, we can take something easy. We're measuring blood pressure, pulse, respiration, skin temperature. So, one of the things that is really dangerous for patients coming into the ER is called sepsis. And so it's a bacterial infection, and it usually causes low blood pressure, a high pulse, so tachycardia, a high heart rate, and an elevated body temperature. So you have a fever, and so perhaps there are signatures in some of the different features that we're measuring that would let us detect that early and see that before it becomes critically ill, low blood pressure and super fast heart rate and a really high body temperature. And so maybe there's a trend that we can recognize. So that's one example of something that we could maybe detect early and prevent from progressing. Because with sepsis, the earlier you can get antibiotics into somebody, the better typically they do.
Wow. So that's potentially life-saving, like, equipment that we're talking about. Like, this is kind of like when I said revolutionary, I'm not understating that when, like, I say that you could actually, like, update like a lot of the medical equipment and kind of revolutionize the data that we have prevention systems. Like what's been the hardest part about getting something like this? It's like because to me it seems like a no-brainer, right? But I'm sure that it's way more complicated just bringing it out there, getting somebody to get it, like all these things. What's been the hardest challenge in regards to that?
You want just one? Uh,
The hardest ones, I
um,
guess.
it's funny that you asked that because I think had we known all of the challenges from the start, we probably would have just given up. But, you know, from the beginning, when we started thinking about this, we thought, even solving for blood pressure shouldn't be that challenging. But once you really dig into the problem, it actually is really complex. And humans are really complex and we're really variable. And so there's a lot of things where when you look at some of the existing methods, if you could apply like one sort of estimation to the entire human population, it would be fine and easy. But you can't do that. And so, yeah, I think some of the challenges are just really being able to create something that is able to measure human physiology and the diversity of what makes us humans in a reliable and meaningful and accurate way. And so that was something that we spent a lot of years working on and are really excited about the solution that we developed because we think that it actually does address those challenges. And then, once you start developing the technology, that there's always the question of funding. So that with any company or any startup, I think is always tough. And then also just figuring out how you can move most quickly with really limited resources. When you have a limited amount of funding and a limited amount of time, it's always hard kind of trying to figure out how to balance everything in addition to really understanding and characterizing this new technology. So, yeah, I would say those are maybe the top couple.
No, absolutely. I mean, I can't imagine like you to hold down a job, to be able to do this basically on the side and fund it yourself. I mean, I can't. What sometimes shocks me is to see like things like this that could literally like help improve society as a whole, like kind of revolutionize the medical industry, and like not see kind of like big money behind it, or like these vast organizations, maybe even like a health insurance that might save money from having patients like suffer less, so they have to pay less. Like I just there's just so many ways. I don't why is something like this, like, do you think, like, funded by, like, a small startup or like what you guys did? Is it something that you just thought of that maybe nobody else did, or is it an economic reason? Like, what do you think?
I think we identified a need, and really looked at the challenges associated with the need and the hole that was in the space that we wanted to fill. And so because of that, we developed a technology that was responsive to all of those different problems. And so I think that's really helped us get funding is I think we thought about it in a different way from the technologies that currently exist. And so that makes it a little different than everything else out there. Um, so yeah, I don't know that I have a great answer to that question, but
Sure,
that's
yeah, I was just I figured I'd ask because it was so interesting to me because it's like, it's such an incredible invention. Like, I just, like, I never even would have thought that something like this would have came from somebody just, like working a job and doing this whole thing. Like I always thought that these things came from some sort of think tank or something, but what you've done is actually like incredible. It's I'm actually really excited to hope to see it like implemented.
yeah, I think it's really valuable to think of a problem or to identify a problem and then develop a solution to that problem. Whereas, maybe if you look at a big academic institution or a big uh, company, they have lots of resources available and maybe they're like, oh, this is a cool technology. And so they're trying to find a use case for that technology. But in our case, it was kind of the opposite, where first we identified the use case and then really just like kept iterating on what we could do to improve the technology to solve that use problem. Um, and so I think that's potentially what helped it uh, kind of overcome a lot of the barriers and challenges.
No, well, that's absolutely incredible. And also, just uh, I guess the fact that you're in it every day, like I'm sure that that helped a lot to just like seeing it every day, whereas somebody would maybe in like an organization, it's like you said, it's just like they're so far away from it that it's just like crazy. But I'm just so happy because like I said, I don't know medical devices in great detail like that, but just I would have thought that, like you said, we've been to the moon, that we would have had something like this already. And I think I realized that a little bit because I went to go get a physical recently, and luckily through this like government program, I went on this other type of medical program that they have where in my state, New Jersey, that's only given out to like police officers or people that work in government. And the physical that they get done versus the physical that you go get done at another doctor, like it's completely different. Like they do the heart tests where they hook you up and you run on
Yeah.
treadmills and all that stuff. And like normally I think you have to ask for that, or there needs to be a
Mhm.
need for it
And
specifically.
insurance might not cover it.
That's what I think it is too. Yeah, the insurance where you have to specifically request those things, but it made me feel finally like I was, like, in our century. Like, I'm like, "Wow, this is what
Yeah.
healthcare is supposed to be." And anything that we could get to advance to that level is something that I'm totally excited about.
I think we're pretty bad at preventative medicine for the most part. We're really good at if somebody comes in sick, like, let's fix it. But figuring out how we can keep people from getting sick in the first place is something that hasn't had a lot of emphasis until fairly recently. Thinking about things like diet and exercise, and to your point, comprehensive monitoring or better monitoring or early detection of disease. And so that's something that hopefully a device like this can really help address is um, empowering people to understand their own metrics and their own cardiovascular health at home, and then being able to share that information easily with their physician.
Well, I'll tell you what, the need is definitely there because if you've seen anything like the smart rings that have come out,
Mhm.
people like go crazy just to find out their stats and everybody's trying to like health hack and everything. And the need for some sort of technology, these devices, I talked to my doctor, at least he said that they're really like, they're not as articulate or like specific as
Yeah.
maybe that he would like. But, I think that the demand is definitely out there. Um, but I
Yeah.
did wanna ask you, how did you get into this field? Like, what made you go to the health field?
With medicine, I guess I started off as a kid who was just always really interested in science. And no idea where that came from because neither of my parents were in science. So it was definitely kind of finding my own path to get there. But I went to space camp. I was just like really interested in space flight, and biology and astronomy and just so many different scientific disciplines. And so when I was an undergrad, I ended up doing a couple of different internships at NASA. And then I also studied abroad in Kenya for 6 months. And when I was studying abroad there, I worked in an HIV clinic. And I remember that being kind of the first time that I really started thinking about medicine. But I also found it really challenging in a lot of ways where there were a lot of cases that were just kind of heartbreaking, and so I wasn't really sure if that was something that I could handle or do on a daily basis. And so kind of focused in on the aerospace stuff and ended up going to grad school to do a PhD in preventative medicine and public health, virology, and space life sciences, which is kind of a random mix of things. But it all made
Super
sense
interesting.
in my dissertation. um, And so, then about halfway through grad school, really started thinking about the impact of the research that I was doing, and it really got me thinking about medicine. I wanted to understand the human body better. I felt like I understood how viruses worked and the immune system worked to interplay with those viruses, but I didn't really understand the rest of the human body. Um, and I felt like some of the work that I was doing might help a group of astronauts maybe 10 years down the road, but in medicine, I'd be able to help lots of people every day. So it was kind of those things that made me start studying for the MCAT and ultimately applying to medical school. So as soon as I finished my PhD, I went to medical school, and then eventually went into emergency medicine because I kind of liked everything, and emergency medicine's a little bit of everything. So.
Oh, is that how you made that decision? Because I know, that emergency healthcare, like, I've seen on TikTok, it could be very stressful, like, did you,
Yeah. It can
is that a
definitely
challenge for you?
be very, very stressful, to the point where you're thinking about, "Okay, do I have 2 minutes to go find an ultrasound, or should I prioritize this other thing?" Or, um, you know, "Is this person's telling me about their toenail that's broken, but I just had a patient whose heart stopped 10 minutes ago." Like your mind is kind of running back and forth and doing a lot of different things. And I think there's a lot that can be challenging. And, to the earlier point about working in the HIV clinic, there's a lot that can be emotionally taxing sometimes, but it's also really fulfilling, I think, in that I have the opportunity to help people when they're probably having like the worst day of their life in some cases. And you really can make a difference. You really can save a life. And I think to me that makes it all worth it.
Oh, absolutely. And I mean that's to someone who's been in the hospital, more times than I'd like. Just having somebody there, like even your doctor, just have that compassion and just that kind demeanor. That sometimes that means everything, even more than the care. When I think it's like you said, it's sometimes it's like the worst time of your life, and so yeah, I think that's super admirable, and especially like I said, because it's so stressful. I mean, what's the worst thing you think you've ever dealt with, as far as, like, being in the ER?
I mean, I think anytime you lose a patient, that's really challenging. Anytime it's a kid, that's even worse. So those cases like really, really stick with you. And, feel so much empathy and compassion for the patients and the families and the circumstances that led them to be there. But I think we're really fortunate to live in a time where we have a lot of technology, we have a lot of capability to save lives. And I'm really grateful for the tools that we have available that, 50 years or 100 years ago we didn't have.
No, that's incredible. Did that mess with you just out of curiosity? Is it hard to kinda switch off from when you go there to kinda come back home and be like? Because I know sometimes I have a stressful day and I'm like, I'll talk to my girlfriend and it's very stressful. I can't imagine on your level, like, how that would be. Has that been a challenge, like, in the beginning? Did you get used to it?
Yeah, absolutely. And I don't think that ever stops. I think if it does stop, I would probably be worried about like my humanity. um so yeah, I mean, I think it's part of the job and it's something that you learn to cope with and that you learn to compartmentalize as much as you can so that you can move on from those things. But that was something that when I was working in the HIV clinic, I struggled with a lot. And I remember there were cases where, again, especially the kids, I would come home and like cry and just like be so frustrated with how unfair life can be sometimes and the circumstances that these like kids and adults and everyone else were going through that were out of their control and now affected their life for the rest of their lives. Um, and so, yeah, I think there's a lot of sort of grappling with the the unfairness and the uncertainty sometimes, and you just try to work through it and to the point not let it affect your own life as much as you can when you're outside of the department.
Right. No, absolutely. But, on a break note, I mean, it must be kinda nice to have your partner who you do the business with, because I mean, business time is probably also time you get to spend with your partner, no?
Yeah. Yeah, it's pluses and minuses. It's good, I think in the sense that, you have someone that you can talk to about all of the things and, the company and what's going on. On the downside, it never stops. Like, it's really hard sometimes to say, like, "Okay, we're not gonna talk about work right now. We're just gonna, like, be a family outside of that." But yeah, I think it's great. We're really lucky, and I think our skill sets really complement each other a lot, so that's really helpful too.
And, what kind of part does he play in the company?
So he's an engineer and a physicist by training, so just really brilliant. Has like probably over 100 patents at this point. Just like a really fantastic inventor, and I think it's really cool because he's able to think about things from a engineering, physics, math side of things, but apply them really well to biology. And I sort of come more from the biology side, but can apply some skill sets in physics and math. And so we have these two different perspectives that kind of meet in the middle. And so it's really nice when you can have complementary skill sets and use those to think about interesting problems.
Oh, that's incredible. How long have you guys been together?
I think almost 12 years, a while.
Congratulations.
Yeah.
Oh, that's so awesome. You guys have, like, the business together, like, no, it just sounds great. And the patent thing is also very interesting, like, what kind of things has he invented?
So he does a lot of work in molecular biology. He's able to apply different techniques to a wide variety of different topics and disciplines.
Wow. Even that term is just, like, intimidating. Molecular it's like, he must be very smart to be able to, like, accomplish things like that, and it shows by the kind of product that you guys made. So what's the name of your company?
Esperto Medical.
Esperto Medical, okay.
Yeah.
How did that come about?
We we're sitting with our third co-founder. So we developed the technology at the California Institute of Technology. And so we were sitting in our office there, and there's a big map on the table. And so we were kind of talking about different places that we'd been and languages that we spoke. And myself and the other co-founder have both spent some time in Brazil. And so we're kind of talking about different things in Portuguese. not like a fluent conversation. Mine is not that good, but kind of just talking about things and eventually kind of settled on Esperto, which means sort of clever in Portuguese. And so that kind of stuck. We stayed
Oh,
with
wow,
it.
I didn't think it does mean that. Yeah, yeah, yeah. That's so clever. No, that's
Thanks.
so cool. Honestly, this is one of the more interesting, I think, segments I think we've ever had as far as the technology, as far as what the capabilities are and what you're eventually going to do with this. Is there anywhere anybody could reach you out if they wanted to check you out, like see where you're going, like your socials or anything?
Totally. Our website is esperto.health. And then I'm on LinkedIn and um, yeah, so I think people can reach out that way.
Absolutely. Well, thank you so much for coming on the podcast. I had an absolute great time. And
Awesome. Thank you so much for having me.
absolutely. Have a good day.
You too.